My name is Dr. Brian Hart, and many of you may know me as a family physician that works at the Stones Mills Family Health Center just down the road. And the mayor and council have asked me to pop into town hall here and give a little bit of the Gananoque perspective on this virus COVID-19 that everyone is, I am sure, very aware of. I just want to maybe start by just saying calm down. As I was coming in, I couldn't find a radio station that wasn't talking about COVID-19 and the need to self-isolate and this pandemic that's coming. I think it's important to realize why it is we're all being asked to self-isolate. So looking at the virus, COVID is it's a coronavirus, of which there are 7 types that transmit to humans. One of them was SARS, which we're familiar with from the early 2000s. There's MERS, which is I think it's in Egypt. You get those from getting very close to camels. And then there's this one, COVID-19, which stands for coronavirus, first found in 2019. So the problem with it's a SARS, it's a sudden acute respiratory syndrome 2, and it's a new virus that none of us have seen before. So the issue is that none of us have any native immunity to it. So if we're exposed to it, there's a very high probability that we will get it. So that's a bit of an issue. If we're exposed to it, there's about a 92% probability that we will have a mild to moderate illness and have no trouble. So in terms of who's going to get into trouble, and what we're trying to do with the social isolation is to try and prevent it from spreading rapidly to the population. So if we're all close and we're all non-immune, we can pass this virus along very quickly, and all of a sudden everybody can have it. And even if there is a very low probability of people getting very sick, if a small percentage of the population gets sick all at once, it will overwhelm our healthcare. So who's at risk? And let's kind of look at that. First of all, if you are over 80, that's a dangerous situation to be in. So these are the people that we're trying to protect. They have about a 15% mortality rate at this point. Over 70, we're down to 8 or 10. Between 50 and 60, we're down to 0.1. Between 30 and 40, 0.01. And below 30, even lower than that, with an overall mortality rate of 2%. So these are numbers that may change. We're hoping that in a lot of countries where we're getting the data from, a lot of people are going unswabbed, so the percentage of patients that get into trouble is actually a lot lower. So if there's 1,000 people that are sick that we're aware of, but there's actually 10,000 people that are sick, then the risk to the people, those percentages drop significantly. But let's assume they're correct. So what we're trying to do, if you are under 50, your risk is quite low, but it's our elderly, it's our vulnerable, it's our patients that have respiratory illnesses, that have heart disease, that have diabetes, that are unwell. Those are the people that we're trying to protect. So the bottom line is it's a concern, and we don't want to downplay the concern. We don't want to downplay the fact that if this comes through the community, some people will not do well, but the majority will do well. The younger you are, the better your chances. But as a community, we want to pool together and protect those that are the most vulnerable among us, such as those over 70 and those with pre-existing health conditions. So that's the point of all of this. Now, not to let the young folks off the hook, although their risks are very, very low, if enough of them get it, they will, 1 or 2 will get into trouble, and you can point to examples in various countries where young people have come to trouble and passed away or died, but their risk is very low. We've heard a lot in the media about area under the curve, and what does that mean? Well, so given that none of us have any immunity to it, basically if I were to get it statistically, circulating in the community, I would give it to 2.4 people. So it's kind of like that old Clairol commercial from the 80s. I told 2 friends, and so on and so on and so on. Very quickly, it'll spread through the community. We've seen that in places like, obviously, China, where it wasn't recognized for a while, and Italy, that has an amazing healthcare system, but this virus got ahead of them. And what happens then is everyone in the community, or high percentages of patients and there are people in the community, contract the virus. they contract, they give it to that small percentage that are vulnerable, and suddenly we have a very large number of vulnerable people that are very ill, and it can overwhelm the healthcare system. So if we maintain social isolation, i.e., I go to Baldry's with my hand sanitizer, I put it on my hand when I touch the cart, when I use the pin pad, I don't get close to people, I buy what I need, a modicum of toilet paper, and then I come home with my sanitizer, wipe my hands down, unpack everything, wash my hands. I don't go to restaurants, I don't go to the theater, I don't have the bridge club over, I don't go to the bar. If I'm socially isolating and not seeing a lot of people, then the number of people, if I get it, I will give it to, will hopefully be 0 or less than 1. So then what happens is if this virus enters the community, then we don't have a surge of sick people. We'll have a very slow number of sick, or a very small number of sick people over a long period of time, and the system can handle that. The longer we kick the can down the road, the better things are. Number one, just based on sheer numbers. So if we end up meeting people that require ventilation, the fewer people we have, the less we will be struggling to find ventilators. The other thing is they are looking to find medications that help. This is a really rapidly evolving crisis. In the States and in other areas, they're doing research on antivirals that we use for HIV-type viruses. This is a similar type, although not in the same class. And there's some initial thought that may be successful. And I heard that 20 minutes ago. So it's evolving. And then a vaccine, although hopeful, is realistically 12 to 18 months away. But what we want to do is sort of flatten that curve, keep the number of people that are getting acutely ill small in manageable numbers, push it out as long as we can until we can find either a cure, better medications, or a vaccine. I'm a little confused about this, and if I am, as a physician, find it hard to kind of correlate all this information and what to do and what to recommend for people, boy, it must be hard for people at the coffee shop. So basically, what are the symptoms of this disease? First of all, let's look at where we are. So our social isolation, our trying to decrease spread, our swabbing of people, are trying to find people that may have it and contain them so we can prevent something we call community spread. Community spread is when I have it, go to Baldry's, and I don't want to pick on Baldry's, but I have it, I go down the street and I give it to somebody else. At this moment, as of right now in Kingston, there are 4 cases of COVID. Confirmed, all of them have been related either to COVID contact or travel. So there has been no community spread in our community. There are 4 cases of travel or otherwise related cases in Kingston. There are no cases in Brockville or surrounding areas, and certainly none yet in Gananoque. So this is good news so far. What to do if I end up, wake up tomorrow and I have a fever? So given that there's no community spread, and I work in a medical office, so that's a little risky, but if I were delivering the mail, or if I worked for Hydro One or Fortis, the likelihood of me having this virus is very, very low. So we have a couple questions, and currently the definition, or currently what we ask people to do is if they have an acute respiratory tract infection, do you have a fever? Most patients with COVID-19 will have a fever. They'll have a cough, they'll feel fatigued, they may have some diarrhea or stomach upset. Not to confuse it with the stomach bug that's going around now. The primary one is fever and cough. If you have that, and you have traveled anywhere outside of Canada in the last 14 days, or you have been near somebody or close to somebody that has traveled outside Canada in the last 14 days and has a fever, or somebody who you know has COVID-19, if you meet that definition, you're sick, you have a fever, you've traveled or been around somebody that has traveled in the last 14 days that is sick, then we want to see you at the COVID assessment clinic in Kingston. There you will be greeted and you'll be swabbed and you'll be assessed and counseled in terms of what to do. At this point, without community spread, if you have just a respiratory tract infection and you've got a fever and a cough and fatigue, you may have rotavirus or influenza. Actually, influenza is very common in the community right now. Unlikely that you have COVID. So what we want you to do is if you have a regular cold, it's a mild to moderate illness, and you know how you feel, you just want to go to bed. At that point, we want you just to do that. Go home, go to bed, self-isolate, don't go out of the house, and stay there until you've been well for more than 24 hours. So if you meet the definition of a cold or a flu or a virus of some sort with fevers and chills, feeling unwell, and you're mild to moderate and can handle it at home, just stay home, self-isolate, and do that until you're better for a day. If you're concerned, if you've got a fever and chills and you feel that you need to be seen or assessed, and you don't meet the definition for COVID, i.e. you don't have that travel component, then call your doctor's office. Give our office a call, give your family doctor a call, your nurse practitioner a call, and we can help to sort you out. And from there, we'll determine whether or not you need to be seen. Usually a talk with a doctor or healthcare provider can help you out and determine if you need to be seen and help you to reassure you that you're going to be well. Who needs to come to clinic? So it's very important. We, I think, have a great staff, and we've got doctors, nurse practitioners, and staff that I think do a great job, and we really, really want to protect our patients. The common waiting room crowd are just those people that are at risk, and we want to protect our staff from getting this illness if it comes through the community, because without staff we cannot open, we cannot help, and we want to protect patients that come in to see us from this virus, because that would be a bad thing to come and get help and then end up getting a bad illness. So what we want you to do at this point is we have stopped all non-urgent in-office visits. So we don't want to see you for your usual blood pressure check or your annual physical. If you have health questions, we will deal with that over the phone. And so all kind of elective appointments, just follow-up blood pressures, follow-up annual health exams, etc. We're going to kick that can down the road 3 months, and we'll rebook those. So the staff will be calling, or we'd appreciate if you call us to cancel or rearrange those appointments. Acute appointments that can be dealt with over the phone. We'll either give you an appointment time, or if you give us a cell phone, your primary healthcare provider will give you a call later on in the day, and we can discuss it to determine whether or not you need to be seen. If it's obvious you need to be seen, then you'll be given an appointment. I saw patients yesterday who just had surgery and needed their staples out or stitches out, etc. Happy to work those in. But what we will be doing, everyone that comes in the office or everyone that's coming down, we want you to call ahead. So only come down if you have an appointment. When you call, we're going to screen you, obviously for respiratory tract infections. So do you have a fever? Have you traveled, etc.? So we'll be doing a screen there. When you come into the clinic for your appointment, it's important that we maintain a 2-meter distance between yourself and our receptionist. We know everyone's going to use common sense and not come down if they're sick, but somebody could wander in. It's a medical office, so it's important that we keep patients 2 meters away from our receptionist until we can do a in-person screen. And here you'll be asked again, do you have a fever? Do you have a respiratory tract infection? Have you traveled, etc.? And then if cleared, we'll take you hopefully directly from the check-in area to the exam room and avoid people congregating in the waiting room. So we're doing a few changes. Number one, just to summarize, no walk-ins. Do not come into the clinic just walking in looking for something or to book an appointment. Please call ahead. Expect quite reasonably to be screened at the time of calling, screened when you come in, and if your condition changes, call ahead and we can deal with that by phone. Our physicians, not just at our clinic, but Dr. Maitland, Seeley's Bay and Lansdowne, have converted to doing as many visits as we can, either by Skype, by the Ontario Video Health Network, or just by phone. If you do need to be seen, we're going to take every precaution to keep both you and our staff safe while you're in the building. And we'll take it from there. I think this too shall pass in time, but we really need to be precautious, certainly in the beginning stages of this. On the after-hours clinic, so as many of you know, collectively, the doctors in Gananoque, Lansdowne, and Seeley's Bay provide after-hours and weekend call coverage. So these are for patients that after hours need to be seen. So collectively, we've made a few changes. Our clinic, it used to be, come on down, here are the hours, first come, first serve. Understandably, having a waiting room full of 19 people that are sick does not make any sense in this environment. So what all clinics have done is we are offering on-call services, but we're doing them through booked appointments. So, for example, someone in our clinic is on call tonight. So rather than open the door and just let everybody in, there'll be a clinic number to call. All appointments will be open as of the start of today. None of them are pre-filled. They're all available for same-day patients. And what will happen is you'll be screened. We'll ask you what it is you need to be seen for. And if possible, the doctor on call will just give you a call and deal with it over the phone. If it's something that needs to be clinically assessed, you've broken your leg, then we'll give you an appointment time, and then we'd ask that you come down at your appointment time to be seen. So when you come to the clinic, we would ask that you come alone or with one other support person. So what we don't really want is I'm at home with my kids and my neighbor is working or away, and I've got her 3 kids, and to have a waiting room full of people. So we're trying to minimize the number of people. So if you're offered an appointment, come on down, try to arrive as close to on time, don't arrive early, and come alone or with one other person. Again, if your condition, don't come to the clinic expecting to be seen. If you have not called ahead, we'll send you home or out into the parking lot and give you a call on your cell. So the last thing I want to talk a little bit about is stress and stress management. The problem is, as I alluded to earlier, you cannot turn on the radio, the TV, the newspaper without seeing a death toll in Italy, without seeing border closures. I mean, who imagined 2 weeks ago the NHL would be shut down, the NBA would be shut down, restaurants would be shut down, the border would be shut down, all holidays would be canceled. I mean, this is absolutely remarkable, and it's over something that we can't see, and we don't have any experience yet. And that's the absolute worst case scenario for stress, something that you're not aware of, or something that you feel is coming, and yet something that you can't see, and you have no idea how bad it'll be. So I hope I've been able to give some reassurance that I think we're all going to be okay. I want to just remind everybody that social isolation does not mean you can't go for a walk. Get out of the house, go for a walk, stay 2 meters away from people if you're concerned, or social distancing. But get out there, go for a walk, enjoy the sun, realize that life will go on, and everything is going to be okay. Nothing like the smell of coffee and hand sanitizer in the morning. But after I got home yesterday, I realized that I may not have been clear in terms of self-isolation guidelines. And these have actually changed as recently as last night. So I just wanted to come and be very clear on that. So basically, in terms of self-isolation, we broadly have 2 groups: those that are well and those that are sick. So those that are well need to self-isolate for 14 days. And that group includes anyone returning from international travel, and that includes to the US. The US has basically no test kits. They have no idea what's going on. If you are a snowbird and you're returning home from Florida, you need to self-isolate for 2 weeks. That group also includes people that have been exposed to anyone that is COVID suspect or confirmed. So if you have been exposed to somebody that's been told they're a COVID suspect or they have a confirmed case of COVID, although we don't have many locally, we still only have 4 in Kingston, then you need to self-isolate. That period of time is 14 days, and that's basically how long it takes about 95 to 97% of patients to develop symptoms. So if you're okay at 14 days and you remain well, you're free to go. The next group are those that are sick, and they include those that are well and self-isolating that then move over into the group that are sick, those that have any respiratory tract infection type symptoms, be that a cough, fever, chills, anything we would define as influenza or upper respiratory tract infections, anything of that nature, you need to self-isolate. You need to self-isolate if you basically have any illness whatsoever. The duration of time for that self-isolation is until 1 day or 24 hours after all symptoms have resolved. So this means the runny nose, the cough, the fever, the chills, you feel well. And you have to feel well for 24 hours. So if you're self-isolating because you returned from Florida and on day 13 you get a respiratory tract infection or a fever, you need to again continue your self-isolation until after 24 hours after you feel completely well. So that's, I hope, a little bit more clarity on the self-isolation. And since they don't invite me out very much, I'll just add one more, one more thing. I just ask everybody, if they could, to realize that all the stores, the essential and semi-essential services in town are open because they are here to help. Everybody that's working the cashier, everyone that's working the counter are here not because they need to be, they are here because they want to serve their community. So I think it behooves us when we go in somewhere like Metro to be very careful to let the cashiers and everyone working there know that we care. So we typically will use our hand sanitizer after we use the pin pad. Why not use it before we grab our card? Why not use it before we approach the cashier? Why not stay a foot away? Why not use our tap if we can? And for heaven's sakes, if you have a cough or anything that be construed as an illness, even if it's asthma or a tickle in the throat, stay away. Just try to make these people know that you care and make them feel that they're valuable in the community. Thank you very much.